If you have low back pain while you are standing, this video is going to explain why this might be happening and what you can do about it. My name is Roxanne and I'm a physical therapist with PT Health Academy. First, please let me remind you to hit like and subscribe, as this really does help my small business have a fighting chance in this very competitive YouTube market. Thank you for your support. Let's review two of the stressors that can be irritating to a low back injury when you are in standing. The first one is load. Load is the pressure downwards on your spine when you are upright. So you can imagine that when you're laying down, there's almost no load, and when you are upright, there is more load. You may be what we call load sensitive, which is very common in an injured joint. If you sprain your ankle, it is hard to walk on it for the first few days because it is load sensitive. Our backs are the same way. So unfortunately, when we're upright, there's more load. So just in standing can be more irritating to your symptoms. What we commonly see in people that are load sensitive in their spines is that in the beginning part of the day, they feel pretty good. And as the day progresses and they experience more load, they get more and more uncomfortable. Unfortunately, this often coincides with the time of day when we are standing still in the kitchen preparing dinner. And that is often a time of significant complaint. Whenever I'm making dinner, I have more pain. I can't stand in the kitchen to cook. Go and sit down and take a break. Then I would suggest you take that break at around the 15-minute mark. If you are constantly standing until your symptoms are an 8 out of 10 pain and then you're sitting down, there's a couple of problems with that. One, it's going to take you longer to recover. It's going to take you longer in sitting and taking that break to bring those symptoms back down to a tolerable level. The other problem is that if you're constantly hitting that 8 out of 10 pain level through the day, that is not a good environment for healing. So if you can plan a little bit, be a little bit more proactive about using those breaks to keep your symptoms a bit lower, now you're creating an environment that your back has a fighting chance to maybe heal up a little bit and actually improve your tolerance to load. The other thing to think about when we're in the kitchen especially is that we often round towards the task that we're working on. We lock our knees out and we kind of slouch over and work, especially if you're tall, right? Those counters aren't high enough for you and you have to round down to the task that you're working on. So you can correct this by either elevating the surface that you're working on, use a box under your cutting board, for example, or stand with your feet further apart, and that will kind of bring you down an inch or two, and then you have a fighting chance to stay upright. Staying upright is important because there's actually less load on your spine when you're upright in a good posture than when you're rounded. That actually increases the load on your spine and can be more painful. Let's talk about the second stressor that can really irritate your back when you're standing. The second one is called position sensitivity. Remember, when joints are injured, they will tend to be happier in certain positions than others. Again, thinking about that ankle sprain, if you roll your ankle in, then for a period of time, it is not going to be comfortable rolling in. It's going to want to stay kind of center and neutral. Your back is the same way. It likes to be more in its neutral position, not hanging out at end range. And when we're in standing, especially if we lock our knees out, we're going to tend to kind of arch and hang out at end range. And if you stay there for a long period of time, standing still, working in the kitchen, at your stand-up desk, that is going to increase irritation in the joints in your back and cause you more pain. So what can you do about it? Well, you can try to stand in neutral. Just tip your pelvis a little bit so you are no longer standing at your end range position. Now, I do warn you that if you've never practiced finding your neutral and holding your neutral, that can be a challenging task when you're in pain and if you've never done it before. It can require some time and some extra coaching. I would suggest that you start practicing laying on your back with your knees bent. You're in an unloaded position and you can practice in a more forgiving environment so that if it is a little tweaky, at least you're not upright and loading it at the same time during your learning curve. Once you've kind of mastered that in laying, then you can try to do it in sitting, and then you can progress to practicing that in standing. And I will recommend that you always keep your knees unlocked, because if your knees are locking back, it is much harder to unlock your pelvis and get it in that good neutral position. There's also ways you can kind of cheat into blocking from that end range position. If you have a stool that you can put your foot up on, raising that foot up kind of naturally or passively kind of tilts your pelvis a little bit, and that can offer some relief. And in the kitchen, you can open the bottom cupboard and put your foot up on the cupboard edge, and that will help kind of tip your pelvis backwards a little bit. If you found this video helpful, please check out my other videos about low back pain where you can find some other tips to help you relieve your symptoms. Thank you so much for listening.